Welcome back to Wally's nursing videos. Today, we're delving into the vast landscape of psychotropic medications, pivotal for psychiatric nursing. We'll explore a spectrum, including selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, tricyclic antidepressants, TCAs, mood stabilizers like lithium, typical and atypical antipsychotics, and monoamine oxidase inhibitors, MAOIs. Understanding these medications is critical for nurses in mental health settings as they significantly influence patient care and outcomes. 1. Selective serotonin reuptake inhibitors, SSRIs. Examples: fluoxetine, Prozac, sertraline, Zoloft, paroxetine, Paxil, escitalopram, Lexapro, citalopram, Celexa. Mechanism of action: SSRIs primarily block the reuptake of serotonin, elevating its levels in the brain, thereby alleviating symptoms of depression, anxiety disorders, OCD, and panic disorder. Indications: first-line treatment for depression and anxiety disorders due to their favorable side effect profile. Side effects: nausea, headache, sexual dysfunction, insomnia, and weight gain are common. Differentiating features: often ending with -ine or -pram, SSRIs are favored for their efficacy and safety in treating various psychiatric conditions. 2. Serotonin norepinephrine reuptake inhibitors, SNRIs. Examples: venlafaxine, Effexor, duloxetine, Cymbalta, desvenlafaxine, Pristic. Mechanism of action: SNRIs inhibit serotonin and norepinephrine reuptake, benefiting patients with depression, JD, and chronic pain conditions. Indications: used in depression associated with physical symptoms or chronic pain. Side effects: nausea, dizziness, insomnia, increased blood pressure, and sweating are common. Differentiating features: names often end with faxine or oxetine. 3. Tricyclic antidepressants, TCAs. Examples: amitriptyline, Elavil, imipramine, tofranil, nortriptyline, Pamelor, clomipramine, enofranil. Mechanism of action: TCAs inhibit serotonin and norepinephrine reuptake, but also affect histamine and acetylcholine receptors. Indications: used in depression, neuropathic pain, and certain anxiety disorders. Side effects: anticholinergic effects such as dry mouth, constipation, sedation, and orthostatic hypotension are common. Differentiating features: names often end with triptyline or pramine. 4. Mood stabilizers, lithium. Mechanism of action: exact mechanism not fully understood, but it stabilizes mood in bipolar disorder. Indications: primary treatment for bipolar disorder. Side effects: fine hand tremor, polyuria, weight gain, gastrointestinal disturbances, and thyroid and renal dysfunction. Sodium impact and toxicity: lithium levels influenced by sodium levels. Low sodium can increase lithium levels, leading to toxicity. Symptoms include vomiting, diarrhea, tremors, confusion, and renal impairment. Differentiating features: requires regular serum level monitoring. 5. Antipsychotics, typical antipsychotics. Examples: haloperidol, Haldol, chlorpromazine, Thorazine, flufenazine, Prolixin. Mechanism of action: primarily block dopamine receptors. Indications: used in schizophrenia, bipolar disorder, and other psychotic disorders. Side effects: extrapyramidal symptoms, tardive dyskinesia, sedation, orthostatic hypotension, and anticholinergic effects. Differentiating features: higher risk of extrapyramidal side effects. Atypical antipsychotics. Examples: aripiprazole, Abilify, olanzapine, Zyprexa, risperidone, Risperdal, quetiapine, Seroquel. Mechanism of action: block dopamine and serotonin receptors. Indications: used in schizophrenia, bipolar disorder, and mood stabilization. Side effects: weight gain, metabolic syndrome, sedation, and orthostatic hypotension. Differentiating features: lower risk of extrapyramidal side effects. 6. Monoamine oxidase inhibitors, MAOIs. Examples: phenelzine, Nardil, tranylcypromine, Parnate. Mechanism of action: inhibit monoamine oxidase, leading to increased levels of neurotransmitters. Indications: used in depression and anxiety disorders. Side effects: hypertensive crisis with foods containing tyramine, including aged cheeses, cured meats, and certain beverages. Differentiating features: reserved for refractory cases due to dietary restrictions and drug interactions. 7. Adverse syndromes: Stevens-Johnson syndrome, SJS, life-threatening skin reaction triggered by medications, serotonin syndrome, potentially fatal condition resulting from excessive serotonin activity, often due to interactions between serotonergic medications. Conclusion: comprehending the pharmacology of psychotropic medications is vital for psychiatric nurses to ensure optimal patient care. By understanding mechanisms, indications, side effects, and adverse syndromes associated with these medications, nurses can play a pivotal role in patient well-being. Stay tuned for more educational content on Wally's nursing videos.